So all of May is Ehlers-Danlos Awareness Month, and that's a connective tissue disorder with no cure, no treatment. It affects everyone differently. Some people can be mildly affected, have no problems whatsoever. And then on the other end of the scale, you'll have people that are pretty much debilitated by the disease. And the average age of diagnosis is in your 30s or older, which for a condition you're born with is pretty much pathetic, and for some people can cause lifelong damage that cannot be undone. The best thing that we can hope for is early intervention in childhood, which would mean, starting physiotherapy to help our joints. For me, I've had over 150,000 dislocations since the age of 10. I've had about 17 or 18 surgeries now, I've lost count. And some are only minor, but some have been pretty major, such as a hysterectomy at the age of 30, which put me in complete menopause because they took everything. I also deal with a shopping list of comorbidities, which is ridiculous, and that includes what they call the trifecta, which is the Ehlers-Danlos, POTS, which is postural orthostatic tachycardia syndrome. I had to think for a second then. And MCAS, which is mast cell activation syndrome. It's also caused multiple organ failure, so that's heart, kidney, liver. I have interstitial lung disease, which is also referred to as black lung or coal miner's lung, even though I've never been around coal mines or anything like that. I'm just one of that lucky percent that with a connective tissue disorder develop it. I've lost all but 4 or 5 of my teeth now. Levels on the hospital pain scale are about a 5 to 7. It's been a long day for me, so I'm very tired. Currently in the process of getting all the testing done so they can be 100%, not 99.9% certain that I've developed type 1 diabetes, which, again, thank you, Ehlers-Danlos. I like to refer to it as a curse that keeps on giving, because you get from day to day. One day you might be fine, you might be able to look and function like anyone else in the community, and then you have days where you're dealing with brain fog, you're dealing with exhaustion, you're dealing with pain, dislocations, and you can't function. But for a lot of us, we have to. And we have to pretend that none of that's going on. Or if it is, it's nowhere near as bad as what it actually is, because people don't like to be confronted with the truth. Like a condition that is up there with stage 4 cancer, but we do not get the pain medication a cancer patient gets. Why? Because we might get addicted. Bullshit. Complete utter bullshit. Why are we not allowed to function? What makes us so different to a cancer patient The only difference is doctors can see their suffering. They can see what's causing the pain, but for us, you can't see the pain. Expected to grin and bear it. And that's not fair. It's not conducive to living a life. It's not conducive to, like, you can't have relationships, you can't work, have families. Alone, my doctor is actually saying to me, on my file, I've had a broken wrist as a result of a fall from a seizure. I've broken my ankle just playing in the playground with a child, torn ligaments in my knee on 2 different occasions. I've torn cartilage in my hip. I've had surgery to remove my teeth and found out that within 5 to 10 years I'll be considered legally blind in my left eye, plus the type 1 diabetes. Hospital visits,